Namaste, Swagatam, and welcome to Nepal. If I was asked to choose only one word to describe the fascinating country of Nepal, my choice would be diversity. Even the capital city, Kathmandu, with its basic guest houses, 5-star hotels, and cyber cafes, has streets where you step out of a time machine into the 17th century. A short drive outside the city will bring you to small villages where life and work goes on in the same mode it has for centuries. From subtropical forests in the south, through lush green rice paddies of the terraced middle hills, to the snowy summits of the mighty Himalaya. The diversity of Nepal is laced together by the daily sacred traditions of age-old religions, Hinduism and Buddhism. These practices bring a sense of tranquility into a nation otherwise pushing desperately to catch up with the 21st century. Sandwiched between the political giants China and India, this tiny, landlocked third-world country is home to more than 24 million people with an average per capita income of under $250 US per year. Almost 90% of Nepal's people are sustenance farmers living in rural areas in the southern Terai region, the rugged foothills of the Himalaya. The vast majority of these people are poor. Some have no cash income. Many of their homes and villages are accessible only by foot, over rough, steep trails. Government health posts and district hospitals are scattered across the country but very poorly equipped. Staff have basic training and service hours are limited. A small percentage of rural people have access to these facilities. Dental care is almost unknown in rural areas. Organizing volunteer medical and dental teams to take services to residents of remote villages is often the only lifeline some of the villagers have to medical and dental care. A welcome dinner and orientation program is held in Kathmandu, where team members meet each other. This event serves to unite the various branches of the team and remind them of our objectives, and also acquaints them with the unique aspects of this year's destination villages. Residents of the villages selected for the current year's camp have also received information about the services and workshops available. Every effort is made to tailor the clinic and workshops to the unique needs of the local people. As soon as one camp is finished, planning begins for the following year. Selection of the villages to be served at each camp is a joint decision between our group, Medical Mercy Canada, and our Nepalese partners, Ecological Protection Forum. Location of the camp determines our mode of transport. In 2008, a last-minute surprise. The new road to Kalti village was not in very good condition. The supply truck would get in, but the rest of us would have to walk from Daringbesi, the district headquarters, all the way to Kalti. We were told an hour and a half, but for most of us it took 4.5 to 5 hours. The heat of the day and the steep hills contributed to the challenges, but also became very much a part of the adventure. The countryside was beautiful. We all learned something of the difficulties faced by the local people if the need arises to transport a family member to the district hospital. The only choice would be to carry the patient over the rough terrain that we were traversing. This wasn't a groomed tourist route. This was the real Nepal. It gave us a new perspective and appreciation of the daily challenges faced by these hardy people. We were fascinated by the scenery along the way, but have to admit that climbing some of those ridges was pretty strenuous, and a rest break every once in a while was really welcome. But who could have asked for a more beautiful countryside to walk through? And finally, we saw below in the terraces the villages that we were heading for. There were still a couple of challenges, some steep downhill, and a couple of streams to cross where a few people got wet feet. But it was still a very rewarding trip. As we were walking the last kilometer or so, the supply truck was also approaching the village. They'd had quite an adventure, and I think in retrospect, probably walking was preferable. As we approached the village, there were some beautiful young women waiting for us with welcoming garlands and a traditional band. Listen to this. We couldn't wait to get to bed, even though that was a sleeping bag and mattress on a cold concrete floor. Morning came almost too early. Breakfast was ready, and we were out there trying to get everything set up for the health camp. A lot of work to do. The lineups had already started. So many people wanted to be the very first in line for the doctors. It was a beautiful scene with all the women in their bright saris and shining faces and beautiful black long hair. Of course, there were things to do before we could get to the patients. Hand out the volunteers' t-shirts. Many local people help as well. The politicians were there to open the camp. For many of the people, this is almost a social occasion and lots of visiting goes on. The patients come first to triage, where they're weighed, where blood pressures are taken, where their complaints are recorded. You can see we have some Western nurses also working with Nepali interpreters. The patients are given assignments to various physicians, and some of the local volunteers escort them to the various examination areas. Our medical teams are made up of Nepali doctors and Western volunteers as well. Our patient load is as diverse as the culture, from infants to the elderly, with a broad range of complaints, most commonly respiratory illnesses, intestinal tract problems, diarrhea, malnutrition, arthritic joint problems. One of the most common complaints are illnesses related to gynecological problems. The women suffer greatly from primitive birth practices, heavy workloads, being out in the fields very soon after childbirth. This young woman came to us severely dehydrated, and it was soon necessary to hang some intravenous fluid and help her to be rehydrated again. She was barely walking when she got to the camp. Our medical team must respond very quickly to problems that sometimes they've never encountered in the city, and their diagnostic equipment is certainly very limited here. Counseling of the patients is one of the important aspects of their responsibilities. Education is certainly the key to many of the problems in the villages. The women receive a lot of counseling regarding family planning practices and other ways to keep themselves more healthy. Each year we have a pharmacy team from the Tribhuvan Teaching Hospital in Kathmandu. We take anywhere from $3,000 to $5,000 worth of medications into the camp that we buy wholesale. Doctors prescribe medicines as they would in their offices in the city, and the patients take their prescriptions to the pharmacy set up at the camp where professional pharmacists fill the requests. The patients are not charged for the medicine, and in many cases, if they had to pay for the medicines, they really couldn't afford to have the treatment. We've been fortunate in several years to have physiotherapy and massage therapy treatments available to our patients. This is something that they would not normally ever have the opportunity to have living in the village environment that they do. Muscle and joint pains certainly are not uncommon in this society. One of the busiest corners of our camp is the dental clinic, and probably one of the best organized. The dental team never lacks for patients. A lot of their time is spent teaching people better oral health practices, scaling teeth that have never had the opportunity to be cleaned properly before, unfortunately doing a lot of extractions, In 2009, we're hoping for the first time be able to offer fillings, especially for some of the younger patients where extracting teeth is not the best treatment if there's any other choices. Our dental team is always made up of Westerners and Nepalis who work very well together.
The children that we have, we should send them to the children's program, because there they get toothbrushes and toothpastes.
One of the most fun, active, and probably noisy parts of the camp are the children's program, where they're taught personal hygiene, oral health, how to brush their teeth effectively, the importance of washing and getting those germs off their hands. And they have lots of fun too, active games to run off some of that energy so that they can sit down and learn. With lots of songs and games and skits, the children have a great time, and so do the volunteers. A new addition to our program this year were women's discussion groups. Small groups of women came together with our Western group leaders and Nepali translators, and they talked about things important to women: health issues, family nutrition, personal hygiene, how to prevent the spread of communicable diseases in their family, meal preparation, and the importance of having clean hands, for example, just very basic things sometimes. The women were encouraged to ask questions. Their discussion was tied in with some of the other programs in camp, such as the clean water and sanitation displays. The group was very, very popular, and sometimes the discussions were quite lively.
They're like amazing.
Another very popular destination in the camp was the clean water and sanitation displays. Groups were taken on conducted tours. The importance of having clean water to keep their family healthy was the focus of the program. These slow sand filters were demonstrated. People were taught how to construct a slow sand filter, one that would be sufficient to filter enough water for their family for a day's supply. Very inexpensive to make, only clean gravel, several grades of sand, a little bit of piping, and a plastic bucket.
Sorry for this.
Each group was taught how to make one of these filters to prevent very common intestinal illnesses that plague families in Nepal. Read Nepal, one of our partner organizations in Kathmandu, had a display in camp to teach people about the signs and symptoms and treatment of leprosy. There were patients that were treated and one woman that was diagnosed with leprosy and referred to the clinic in Kathmandu. Help was given to her to travel to the city for treatment. We also had social workers in camp that had the opportunity to counsel some families that were having problems or needed help with education for their children and other similar problems.
Not in nose, her chest.
No. Can I just open the chest?
Food services, as you can imagine, for as many volunteers as we had at camp were quite a challenge. We had a catering company that did all of our meals, who had to prepare them in very primitive circumstances, but did a wonderful job putting on delicious, nutritious meals for all of our volunteers. At lunchtime with local volunteers, they fed as many as 150 people. Mealtime was always a great time to get to know our fellow team members better and to just enjoy a good visit and share experiences.
Sometimes the audience will have it because of the genetics.
Because they always make a reaction.
डाक्टर हुनुहुन्छ उहाँलाई आफ्नो महत्त्वपूर्ण बनाइराख्नका निमित्त म यहाँ बोलाउन सबैको समान अस्तित्व र सबैको त्यही ढङ्गको सम्मान हुन जरुरी छ भन्ने हाम्रो लाग्छ त्यसैले
3 days came to an end too quickly in many ways, although we were tired. Soon we were gathering for our closing thank yous and recognition of all of the people who had worked so hard to make the camp a success. Speeches were given, hands were shaken, certificates were presented and flower garlands, and soon it would be time to go home. After breakfast the following morning, it was time to get on the trail again and head for home. We walked out a different way, new scenery, new trails, a little less strenuous because a lot of it was downhill. Beautiful countryside and a joy to walk through. Small villages along the way were interesting, and we stopped at one house to have a drink and a little rest. It was another hot day, but here was the local blacksmith, hard at work in his trade. Many people greeted us along the way that had wanted to come and thank us for the service that we had given. How do you like this nice long bridge across the river?
Namaste. Namaste. Bye bye. Bye bye.
We had worked long and hard, and the team had come together beautifully. There's nothing like hard work to bond people in the experience. We finally arrived at a little village where we thought our trucks and bus were going to meet us. Unfortunately, they didn't arrive, and so it was another 5 kilometers out a dusty road to the main highway to finally connect with our bus back to Kathmandu. But by this time, we were up to the challenge. It takes many people to put on a health camp, both professionals and non-professionals. This is a picture of our 2006 team. The annual medical dental camp is only one of Medical Mercy's programs in Nepal. We have other programs that operate continuously throughout the year. We are one of several sponsors of the Children's Future organization Children's Home in Kathmandu, where we help with clothing, school supplies, a library, education resource materials, and other necessities for the children. Networking with other organizations and individuals is an important aspect of our work. We endeavor to connect people and groups with skill sets and resources with worthy recipients in need of support. Another example of this networking activity is the Kanti Children's Hospital in Kathmandu. We are now working with Alberta Children's Hospital in Calgary to develop a mentoring program with this tertiary care facility. Kanti is the only hospital in the entire country dedicated to the health care needs of Nepal's children. In the northern part of Dading district is the small community of Tipling, where this little school in Peru, with its very basic classroom, now has a lovely new school for their students. And in Limjo, this old school was very full, with 105 students in 3 classrooms. Now it has an expanded facility with 7 rooms, with the help of a German donor group. We met with the local leaders and found that the teachers needed some help in the classrooms. Some of them had as many as 105 students in one class, so local youths have been trained to help. In Borley Danda, there's a nice new school to replace the one destroyed in a landslide. Water lines were brought in, latrines were built, water taps were built, and now they have new classrooms. This kindergarten class is really happy with their new desks. They used to sit just like this. Monitoring visits to these villages is always enjoyable. In Karanjay, we had a school with 750 students and no bathrooms. They now have some nice new latrines. And this village school now has a new roof that the villagers worked very hard to construct. Developing effective programs takes time. We meet with local people and leaders to discuss their problems and needs. Then we come together to make a plan on how to resolve these problems. In Maidi, out of this workshop came a plan to create a mobile health clinic to visit the remote villages where people had the most difficulty getting to the health posts. We work with schools to help the teachers teach the health curriculum. We have health awareness days. We provide training for the paramedics in the mobile clinic. Environmental issues are addressed to help the villagers have healthier lives. Operating in Kathmandu is the Reed Nepal Leper Clinic, a clinic that gives free treatment to lepers and also skills training program so that they have some other options other than begging on the streets for support to their families. We've helped develop this dormitory for patients and for participants in their skill training program and have recently put a water system into the building. Like all charitable groups, Medical Mercy Canada's biggest challenge is raising sufficient funds to support the very worthwhile programs that we have. Not just in Nepal, but in Burma, in the Ukraine, in India as well. We do this in various ways by taking tour groups over, holding barbecues and dinners and information nights. We have groups that will make blankets and knit for the orphanage. We're always looking for new, creative ways to raise funds. Why Nepal? Why these people, you might ask? Well, just look at their beautiful faces. How can we, who have so much, not share a little of our plenty with them? In Nepal, there is no welfare system, no social services, no unemployment insurance, no family allowances, no pension plans. Your time, energy, skills, or dollars can make a big difference in their lives. Please help us. We're counting on you.